Today I'll talk about incontinence. So what do we mean by incontinence? Incontinence means when there is leakage of urine, and there are different types of incontinence. And the first type of incontinence is stress incontinence. What do I mean by stress incontinence? Sometimes when you're coughing or you laugh, you experience this leakage of urine. Some women, they come and say that they are exercising in the gym or when they're doing Zumba. So when there is little jumping activity, there is leakage of urine. So basically any kind of stress, if it leads to leakage of urine, this is called stress incontinence. The second type of incontinence is urge incontinence. What do I mean by urge incontinence? So there is a desire to pass urine, and normally we are able to hold on to that desire, and then once we reach an appropriate position or appropriate situation, we pass urine. Now in urge incontinence, there is an urgency to pass urine. And while you reach the bathroom, if the urine leaks, then it's called as urge incontinence. And the third type is called as mixed incontinence, which is a mixture of both stress and urge incontinence. Now I myself did a survey a few years back in which women who were just coming to me for a general checkup, I found that 1/3 of women had the symptoms of urinary incontinence. And the best part about this survey was that women just came for a general checkup. They didn't come to me talking about incontinence. It was when I asked them that are you experiencing any urinary leakage, that is when they presented with the symptoms. And some of the women, when they reach menopause, they actually feel that leaking urine is a normal part of menopause. So which is not true. Now there is a myth that women who undergo vaginal deliveries are the ones who experience incontinence of urine. But again in the study it was found that irrespective of whether you've had a vaginal delivery or if you've had a cesarean, women with cesarean also experience leakage of urine, which can again be stress, it can be urged, or it can be mixed incontinence. Now that you've understood what incontinence is, what can we do about it? So the first and the foremost reason for incontinence is urinary infection. So the doctor may advise you to get a urine routine done or a urine culture done. So if there is an infection which is diagnosed, the first thing which has to be done is to treat the infection. Now what if the urine sample comes to be normal and there is no infection? Then what is the next step? So what we do is we do pelvic floor exercises, and along that we start with medications, and the last part is getting a surgery done. Now the most simple things what we ask you to do is to maintain a bladder diary. So you go home and then you jot out at the times of what time of the day did you experience incontinence of urine. Was it like during the morning? Was it during exercise? While you sneezed? While you cough? Or there was an urgency to pass urine, and could you reach the bathroom or not? So we call this as a bladder diary. So after the first visit, we ask you to maintain a bladder diary and you come back to us. So we get an idea of what is the type of incontinence and what particular times of the day are you leaking. So we start with simple things like you have water between 8 a.m. to 8 p.m. So avoid drinking a lot of water during the night time. And if you're exercising, a very good idea is to empty your bladder and then go for Zumba, jumping or running exercises. And having said that, drink less tea, less coffee and alcohol, because tannin, caffeine and alcohol are irritants for the bladder. Avoid spicy food. So these are some of the simple things which you can follow to avoid incontinence. Next I told you about was pelvic floor exercises, which you commonly known as Kegel exercises. So which basically means that you squeeze your pelvic muscles, and if you do not know how to do it, you can go to your doctor and she'll explain how to do a Kegel exercises. Now Kegel exercise minimum should be done at least 30 times in a day, so which means 10 times in the morning, 10 times in the afternoon and 10 times at night. And it's squeezing the muscles, hold it for 10 seconds and you relax it. Nowadays there is a very good option available. We have an electromagnetic chair available, which basically again works on the principle of Kegels. Now sometimes what happens, even when I'm explaining a woman how to do Kegel exercise, she may not exactly understand as to which part of the pelvic floor she has to squeeze. So when you have this device, which is basically an electromagnetic chair, so what you do is that you sit on this chair, you don't have to undress, there is no prerequisite, just sit on the chair, we switch on the machine and the magnet in the chair will cause pelvic contraction. The pelvic contraction, they say that it occurs 11,000 times in one session, which is of 20 minutes. And you have to take this session, like one 20-minute session, twice in a week, and you are sorted out in 3 weeks' time. Now this electromagnetic chair will work for mild cases of urinary incontinence, and sometimes we add a pharmacological therapy, that is we add medicines with UI cube or the electromagnetic chair, and it may help you with relieving mild cases of incontinence. And what it also does is, there are some tense areas in the pelvic floor, so it helps to release those tense areas in the pelvic floor muscles and eases the urge incontinence. And the last of all, like I said, is surgery. If the medicines, the pelvic floor exercises, or the electromagnetic chair sessions don't help, then surgery might be required. Thank you.